Hello, and welcome to Recognizing Mental Health Distress and Promoting Help-Seeking Behaviors. In today's presentation, we'll be covering the scope of the Office of Health Promotion, talking a little bit about what mental health is, identifying signs and symptoms of mental health distress, reviewing the process known as ALGE, discussing some steps in responding with care, and going over some CWU resources. Your professor may have provided you with a worksheet to go along with the presentation, so please make sure you have that with you to complete during this session. The Office of Health Promotion is located in Circ 256 and can be reached at the email on your screen. There are several individuals in the office who are there to create preventative programming and respond to mental health crises or issues. Please feel free to reach out to any of us individually or to contact the office in general at the email on your screen. The scope of practice of the Office of Health Promotion includes PATH, which is Prevention, Advocacy, Training, and Healing. This is a confidential advocacy service for students who have experienced sexual harassment, stalking, relationship violence, sexual assault of any kind. There's a supportive community available through PATH, including campus events as well as support groups. As an example of an upcoming event, if you're watching this previously to October 17th, is Dare to Care, taking place in the Circ corridor from 11 a.m. to 1 p.m. If you're watching this after October 17th, there are several events that happen throughout the year and can be noticed on the Central Today or on any of the hype sheets in any of the restrooms or on the health promotion website. The Office of Health Promotion also offers substance misuse prevention and recovery. There is a recovery ally training to help others learn how to support those in recovery. There are late night events that help curb drinking and create substance-free community. There's an option to meet with students to plan recovery and peer-led support groups to build a supportive community. Additionally, the office provides mental health education and training. There are preventative programs that take place throughout the year. Commonly in the fall, we do Adulthood Unlocked, and in the winter session is Coping with Clouds. We also co-chair the suicide prevention team and oversee care calls. In addition to the programming previously mentioned, the goal of all of these is to promote community and decrease the stigma around mental illness and to build life skills. What is mental health? Mental health can be conceptualized as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health disorder versus mental health problem. A mental disorder or mental illness is a diagnosable illness that affects a person's thinking, emotional state, and behavior and disrupts the person's ability to work or carry out other daily activities and engage in satisfying personal relationships. A mental health problem is a broader term that includes both mental health disorders and the symptoms of a mental health disorder that may or may not be severe enough to warrant the diagnosis of a mental disorder. How common are mental disorders? According to the CDC and Mental Health First Aid, 1 in 5 of US adults have a mental disorder. Nearly half of all mental disorders start at age 14, and 1 in 25 Americans live with a serious mental disorder. Next, we're going to talk about some common mental disorders that affect college students. Depression. Symptoms affecting an individual for at least 2 weeks and affect the person's ability to work, carry out daily activity, and have a satisfying personal relationship help determine whether a person can be diagnosed with depression. It's important to note that not every single one of the symptoms listed below need to be present for somebody to be diagnosed with depression, but they usually have at least one and often more than one. It's also important to keep in mind that having a bad day or having a symptom that occurs occasionally but not regularly doesn't indicate that someone should be diagnosed with depression. It may mean that they're exhibiting signs that should be evaluated by a professional. Anxiety. Much like depression, these symptoms also should present over at least 2 weeks consistently and affect their ability to work, carry out daily activity, or have a satisfying personal relationship. Some of the common symptoms of anxiety are chest pain, hyperventilation, muscle aches and pains, tremors and shaking, unrealistic or excessive fear and worry, irritability, obsessive or compulsive behavior, and sleep disturbance. Please keep in mind that these are not all of the comprehensive symptoms of anxiety, and there may be additional symptoms that individuals exhibit, which is why it's important when someone is displaying a mental health problem that they go to a professional to be diagnosed so that that way the professional can determine whether that problem is indicative of a disorder. Suicidal thoughts and behavior. Below are common warning signs of suicide. It's important to note that the National Health Survey conducted each year for college students indicates that there is a high degree of suicidal thoughts and behaviors in college students. We want to ensure that everybody is aware of common signs and symptoms so that we can become advocates for one another. Much like with depression and anxiety, exhibiting any one of these symptoms does not necessarily indicate suicidal thoughts and behavior, but it's something to keep an eye out for. Recognizing mental health problems in students. Below are some common statistics, but one thing to be very aware of is that most students indicate on the National Health College Survey that they are unsure of resources around them and how to access local campus resources. We want to ensure that students know what their resources are, where they are, and how to access them. Responding with care and promoting help-seeking behaviors. The process known as ALGE is a part of mental health first aid certification, which is also something that the Office for Health Promotion offers. It is a lengthy, in detail training on becoming a mental health first aid responder and takes about 8 hours to complete. In short, ALGE stands for these 5 things: assess for risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, encourage self-help and other support strategies. It's important to keep in mind that not necessarily all of these steps need to be completed every time you're encountering somebody who might be displaying a mental health problem. They also don't need to be completed in any specific order. You can ALGE, you can EAGLE, you can legal, you can do it in any way that seems appropriate for the situation that you're in. It's important to realize that when you're encountering somebody who may be exhibiting suicidal thoughts and behaviors, that you feel comfortable asking the question directly. Are you having thoughts of suicide? Are you thinking about killing yourself? This can be a difficult thing to become comfortable with, and we often suggest that you practice with a friend or in the mirror so that when the time comes that you might need to ask somebody this question, you can do it in a calm and confident manner. If the answer to either of those questions is yes, then you want to establish whether that person has a plan. Have you decided how you are going to kill yourself? Have you decided when you would do it? Have you collected the things you would need to carry out your plan? A common misconception is that asking a person if they are contemplating suicide will give them the idea to commit suicide. Mental health first aid suggests that that is not the case, and that people either have those thoughts or they don't have those thoughts. Once you've asked the questions, let the person know that you are concerned and willing to help. Discuss your observations with the person and ask any questions without dread or negative judgment. Check for two other risks. Has the person been using alcohol or other drugs? And have they attempted suicide in the past? It's important to remember not to leave somebody who has confirmed that they are contemplating suicide and have a plan to do so alone. It's helpful to provide a safety contact number, ask that person about past supports, contact law enforcement, or get them to a campus professional who can assist them. We'll be discussing additional resources later in the presentation that you can contact if this is the case. It's also important that you make sure that you can never guarantee confidentiality. If somebody is expressing suicidal thoughts, you do need to be able to let somebody know in order to help keep them safe. Promising them that you won't tell anybody and then having to tell somebody can damage the relationship and the trust. In any and all mental health issues, when you're responding with care, it's important to do these few things. Make sure that you're listening. Make sure that you believe the person and what they're telling you. Ask about their safety, empathize with whatever they're going through, give them choices, and give them resources. It's always good to keep a calm presence. Use nonverbal communication to show that you're giving attention, including eye contact, facial expressions, body language, and environmental awareness. That includes the proximity in which you're standing, sitting, or discussing this issue with another person. Some common CWU resources that can help you with mental health issues include our case management team. They can be contacted via the web address or location Bullion 204. Counseling services is located in Black Hall and can be called or their website accessed for more information. Student Health Services is located in that building off the parking lot in the image indicated. It's also important to note that students have access to virtual telehealth. If you have any questions that weren't answered in this presentation, please feel free to email them to the Office of Health Promotion. Thank you so much.